Hey, deserving listeners, Couples Therapy, Let's Watch. My name is Dr. Kirk Honda. I'm a therapist and a professor and a YouTuber. And as I always say, don't use YouTube as a replacement for therapy. If you need a therapist, get one. You deserve it. We all deserve therapy now and then. Let's watch.
It's a feel me thing, know me and feel me thing, that he should figure out how to heal so he can come back on the job
of healing me
daily.
Yeah.
Because he doesn't know what it would be like for him to be the subject of the story and for that to go on for more than 4 sentences or less.
Orna is meeting with her advisor. We would call it a consultant. They are talking about Molly and Josh, and the narrative seems to be focusing, at least this snippet of the consultation meeting, on how Molly is more self-centered, that she is requiring the marriage in a self-centered, selfish way, that the marriage is there to heal her, and he is there to heal her. And they are talking about how Molly needs to adjust that. She has to realize that the marriage is about both people. And yeah, I would agree with that take. Obviously, I can't know really what's happening because I'm not in the room during the full session. So based on what we've seen, that's one narrative. I personally wouldn't focus on that. I would focus on the overall attachment interplay between the two, and that it's a systemic circular causality, we call it, or a recursive cycle, in that, yes, you could say that that is causing some tension, that the wife, Molly, is considering the marriage to be more about her, and he is there for her. And she takes up a lot of space with her emotions and her narrative, and she tends to talk more in session. But in my world, in the marriage and family therapy world, we look at systems. We don't look at individuals. I mean, we can look at individuals, but we also look at systems. And when you have the ability to do that, it's actually really hard to do. With my students in their final term at the university, after being there for 3 or 4 years, they still struggle with this. I struggled with it for a long time. But in a nutshell, with this couple as an example, one could conceptualize the problem as being mutually causal, in that, yes, she's doing that, but he's also participating in that cycle, in that he denies his feelings, and even when she's inviting him and creates space for his feelings, he doesn't step into it. We've seen some examples of that when Orna turns to him and says, "How do you feel about that?" And he turns to Orna and says, "Well, feel about what?" And it's like, everything that just was said, Now, maybe he was just a little confused as to exactly what she was asking about. But if you asked Molly that question, she wouldn't turn and go, huh? He puts himself on the back burner is the thing. Now, he probably had to do that because of his upbringing, but that's part of the mutual causal nature of their relationship. It's also probably why they were attracted to each other, and why, or at least one of the reasons why they fit together so well in the beginning. So that's the way I would conceptualize it, is that both are participating in him denying his feelings. He is doing it and she is doing it. So, and it's causing a lot of problems because he is not getting his needs met. And also, she's not getting her needs met because she wants him to be in the room, so she has an actual partner that is in contact with her. Now, I should say, before I get comments, which I don't know if people would comment about this, but there's a possibility, as I've been saying in these videos, that the wife, Molly, is abusive and domineering and intimidating. There's some hint of that. And in that case, we don't look towards mutual causality of abuse and intimidation. The perpetrator is solely to blame, so to speak. So we wouldn't want to treat the system if she needs to stop that intimidating intimate partner violence, at least-ish behavior. So I just want to be clear about that. But I can't tell from the footage if that is happening. It looks like maybe there's one toe in that water, but not all 10.
Yes.
He perks up when he gets a chance to speak his mind and take the space.
Yeah.
But then when she takes over, you can see this other kind of relief.
Yeah, and as I've been saying, a very common countertransference trap for couple therapists particularly is that we as therapists don't like injustice, and we don't like seeing people being intimidated and shut down, right? So it's natural for most therapists to treat a client like this, a couple, and identify more with the husband and want to fight his fight against the wife. And all of your mind and body and soul and emotions and your own history can, come together to create a therapeutic justification for participating in the dysfunctional triangulation, which is to take on the fused tension in the room and fight her, which is just taking the tension between the couple and recreating it, moving it around the triangle into therapist and Molly. And that doesn't actually fix the problem, right? At least you could argue that if we as therapists fight his fight, then he doesn't have to learn how to fight his fight. That's another way to say it. Now, Orna has been doing pretty well up until this point, so there's a possibility that they're just including this little snippet because it's the most dramatic. Because I've often thought that in the beginning of my career, I thought they should make movies and TV shows about therapy. I mean, so much is happening. And in the consultation meeting, it's like all these mind-blowing things, and it's just like ups and downs and drama. And then you videotape yourself, because you do when you're starting out, and beyond, for review with supervisors or just for yourself. And you realize just how boring the session is from the outside. But on the inside, it's exciting. So they probably had to look for the most sensational moments in both the therapy sessions and the consultation. So it's possible that we're only seeing a little bit. But I will say that Orna's approach has been very good up until, throughout this point.
Wash over
Exactly. And I would want to know, would you like to get your shot at stardom for a while? Mm-hmm. Because I'm going to be asking you more about yourself, and I know you're going to turn me away, and you're going to want to turn toward her.
Okay, good. So I jumped the gun. I take back everything I said. Well, not everything, but at least the emphasis. So they are seeing the systemic, circular, causal, the recursive nature of that he's participating in that too. And that is what Orna has been doing. She's been really making a point to draw him out, and he has been avoiding. He has been turning back to the wife. He has been looking, what do you want me to talk about? Or he'll redirect the conversation back to the wife. And the wife Molly will also chime in, and Orna has had to interrupt at times.
And I'm not going to let it happen.
Yeah. Interesting.
Happy Tuesday.
Happy Tuesday. It is Tuesday, right?
Yeah, it just feels like
I will say I'm not a fan of a consultation meeting happening in a public place. When we talk about clients, we have to be very careful about eavesdropping, even accidentally. Maybe they had some way of making sure that people couldn't hear that. But now what they will say is it's not therapy. I think officially, even though it's called couples therapy, I've heard, and don't quote me on this because I don't know, but I've heard that legally they are telling the participants, this is not therapy. This is a reality TV show that you're agreeing to be on. And you're talking with a clinician, but this isn't a clinical service. And I think they do that to avoid the legal ramifications of it. I'm not quite sure.
You know what day it is.
Mm-hmm.
All right, just chiming in here, the rest of this video will be for members of the YouTube channel. So if you want to see the rest of this video and all the other videos in this series, and whenever I watch this show, at least recently, most of the content is for members, because I want to reward them for literally paying my bills so that I can do this all day. So if you want to become a member, you can by clicking the join button, or there should be a link in the description if you can't find the join button, or it's not there. Sometimes it's not there. Otherwise, please take care of yourself because you deserve it. You really, really do.